So you had a previous cesarean section and now you're pregnant. Should you then have a repeat cesarean section? Hi, my name is Nate and I'm a doctor working in obstetrics, and today we'll be talking about the options if you've had a previous cesarean section. So C-sections, or sections for those in the know, are common, with about 29% of all babies born in the UK are born via a cesarean section. However, that doesn't mean that if you've had a previous cesarean section that you will always need a repeat cesarean section. And we're going to talk about the different options someone can have for their current pregnancy having had a previous cesarean section. So we need to start by explaining the different abbreviations we typically use to explain care. So firstly, we have VBAC, which is the commonest short form you may encounter when visiting your midwife or obstetrician, and it stands for vaginal birth after cesarean. We often use this term for women who wish to have a vaginal birth after a previous cesarean section. But with me being pedantic, I would typically use a different term, which is TOLAC, which stands for trial of labor after cesarean, because the way to achieve vaginal birth is the process of labor. However, someone who's even pickier with their choice of word may use a different term called LAC or LAC, which stands for labor after cesarean. You may sometimes see a number with these abbreviations like VBAC or TOLA3C, and these numbers mean how many cesarean sections a woman previously had. So LA2C would mean labor after 2 cesareans. You may also see ERCS documented, and that means elective repeat cesarean section, while some professionals would prefer using ELSCS, which stands for elective lower segment cesarean section. And I will have more information about cesarean sections in the description below. And finally, CBAC stands for cesarean birth after cesarean. Gosh, so many acronyms. It sounds like a repeat cesarean section, but with a twist, so you have to keep watching this video to find out more. If you've had a previous cesarean section, the main decision you have to make is whether you wish to labor. And it's important to know, what is the rate of having a successful vaginal birth? And what are the risks of labor versus a repeat cesarean section? Although most women can labor safely, there will be some which we would advocate for a repeat cesarean section. For instance, if there was a previous uterine rupture, or a history of myomectomy which breaches the uterine cavity, or a placenta previa when the placenta covers the entrance to the womb, or if the previous cesarean section is complicated by a classical incision, which is when the cut is made through the upper segment of the womb, or any complicated incisions for that matter, we would usually advise for a repeat section. Women who've had a previous section have a 3 in 4 chance of achieving VBAC, and the chance increases to 90% if you've had a previous vaginal birth. Of course, there will be factors which influence the chances of VBAC, and they include whether the labor was induced, the mum's BMI, the interval between the previous section and the current pregnancy, as well as the reason for the previous cesarean section. Now let's take a look at the risk of harm occurring to both the mum and the baby. The main concern which keeps obstetricians up at night is the risk of uterine rupture, which is when the wall of the uterus opens up completely. Thankfully, it's uncommon, with an incidence rate of 5 in 1,000 for women who labor spontaneously after one previous section. There are factors which increase this number. For instance, if the labor is induced or augmented, the use of the oxytocin drip increases the rate to 10 in 1,000, whilst the use of prostaglandins for induction increases to 20 to 1,000, which is why we prefer the use of mechanical induction for women who've had a previous cesarean section. The risk also rises for women who've had multiple previous C-sections, with women who've had 2 previous cesarean sections having a chance of 13 in 1,000 for a uterine rupture. Although uncommon, uterine rupture is particularly scary because it dramatically increases the need for blood transfusion for severe blood loss, as well as a need for emergency hysterectomies. There is also a risk of stillbirth, which is roughly 3% in term pregnancies. Although uterine rupture can sometimes present with abnormally severe abdominal pain, bleeding from the vagina, or blood in the urine, the best way to identify it is by monitoring signs of fetal distress. Because of these concerns, most professionals would advise laboring in the obstetric unit with continuous fetal monitoring. You may wish to avoid continuous fetal monitoring or regular vaginal assessments, or perhaps you're motivated to have a home birth. There is nothing stopping you from realizing your birth plan. However, I strongly advise you to speak with your healthcare professionals so as to ensure that your childbirth experience is as safe as possible and to draw up solutions for possible complications. Other maternal risks include infection of the womb, blood transfusions, and mortality. So for babies, the commonest issue is breathing difficulties soon after birth. Interestingly, having an elective cesarean section increases the chance of this happening from 2 to 3 in 100 to 4 to 6 in 100. Oftentimes this is transient, but occasionally babies may need attention at the special care unit. Unless there were other clinical reasons, we would typically schedule an elective cesarean section from 39 weeks onwards to minimize the chance of this happening. For those who are aiming for VBAC, there is a slight increase of stillbirth with an additional risk of 0.1% whilst waiting for labor to occur spontaneously after 39 weeks. And lastly, the risk of brain damage due to the lack of oxygen during labor is 8 in 10,000 compared to less than 1 in 10,000 for an elective cesarean section. When deciding whether TOLAC is appropriate for you, it's important to note how you feel feel about the possibility of severe vaginal or perineal trauma, as well as a potential need for instrumental birth or an emergency cesarean section. Now I'm going to test to see whether you've been paying attention in this video. Do you remember what VBAC stands for? So cesarean birth after cesarean is what it says on the tin. However, we often use this term to describe anyone who opted or required a repeat cesarean birth, including those who were aiming for a VBAC but the baby was born via a cesarean section. If you've considered labouring for this pregnancy, then there are a few more things to decide on. Firstly, how do you feel about induction if labour doesn't start spontaneously? And what are your thoughts about the oxytocin drip if labour doesn't progress adequately? Indeed, some women may decline an induction if they don't labour spontaneously after 40 to 41 weeks and prefer scheduled elective section at 40 or 41 weeks instead of an induction. I'm going to talk more about cesarean births in my next few videos, so please subscribe as not to miss out. If you are considering a repeat cesarean section, do think about what your preferences are if you labour spontaneously before the date of your section. As mentioned earlier, we typically arrange elective cesarean sections from 39 weeks onwards, but you may be one of the 10% who labours before then. If you find yourself in this position, consider whether you wish to continue with labour or you'd prefer to proceed with an emergency cesarean section. Unless you're fully dilated and the baby's head is very low in the birthing canal, an emergency cesarean section is still a suitable option. Birth is an incredible journey and we're here to provide you with information so that you can make the best choices for you. If you found this useful, please give this video a like and share it with your friends and families whom you think will benefit from it. I'll leave some links below, including a checklist published by the Royal College of Obstetricians and Gynecologists. I'll see you again soon.